Good day. My name is Dr. John Dombrowski, here at the Washington Pain Center, obviously in Washington, D.C. I want to kind of shoot this video for making an observation that I've seen. There are a lot of changes here in the Maryland, District of Columbia, and Virginia area with insurance issues, employment issues, and things like that. And I read the papers like everyone else, and I'm just really disturbed by that. Also, I've noticed that a lot of my patients are with certain insurance plans that may not cover really their medical care that they truly need. Whether the insurance might say, well, we can only do this injection every 6 months, or whatever the case might be. The patient says, well, I need it 4 or 5, but they're not covering. Or for whatever reason, the plan just doesn't cover anything. So with all this being said, we've done some thinking here at the Washington Pain Center to come up with another plan. Actually, it's the old model where I have complete transparency in terms of billing. It used to be patients would come in, they know what the bill is, and they would pay what they accepted to be, and they moved on with their day, and they didn't really deal with insurance. Now we're kind of seeing that again with the concierge model of medicine, where patients would pay thousands of dollars for the interns just to be readily available, but then still pay the insurance for their visits or whatever the case might be. Well, we're going to do the same thing here. We're going to have a concierge model. We really don't think that's fair, but I think what we can do is come up with a model that is fair. So we're now going to put on the website cost of an office visit, cost of a follow-up office visit, cost of an injection, cost of other procedures that you as a patient would want. This way we kind of short circuit the need of the insurance company, the need for other practices. Sometimes they can't see you in a timely manner. Here, when we focus on therapies like this, it's the summer season. People are traveling. They want to go to Europe. They want to go on a riverboat cruise or do something, and they can't wait for that doctor's for 2 weeks to be seen, or the insurance to say, well, we'll take care of it in 2 weeks or thereabouts, if they cover it at all. So if you have the need to come in sooner, and if you have the need that you're traveling, and if you have the need that you need more immediate care, we'd like you to give us a look at the Washington Pain Center, and then you can clearly see what procedures cost and what you would be responsible for. I hope we find this to be a really good way to move forward, to come up to be a bridge between people going on vacation, people losing their insurance, employment issues. So I think this is a good model to really get people the care that they need, but also make sure everything is fair for both parties, the patient and our practice. Thanks for watching, and let us know if we can help further. Thanks again.